Okay, I think I'm recording now. Is it good? Okay, I'll start. So we're group 19 and our presentation is how understaffing affects communication. This is our table of contents. We're going to start off with why we chose this topic before hopping into background info. Then we're going to talk about communication in nursing, effects of understaffing, improvements, and lastly, our sources. So to begin, why did we choose this topic? Our decision to choose this topic was mostly sparked by a discussion that we had in our other nursing class, Nursing 412. It was about how travel nurses in the healthcare system, it was about travel nurses in the healthcare system and how we have an over-reliance on travel nurses and how that's created a financial imbalance as well as a huge understaffing issue. According to US News, there is a projected overall shortage of 1.1 million nurses. This means that there's no escape for all of us who will eventually live and work in such an environment. So rather than ignoring this issue, we should embrace it and learn how to best combat it. Understaffing is a huge issue because it has induced a huge strain on the healthcare system. Some patients aren't getting the attention that they need, and the remaining healthcare workers feel stressed and have to take on so many more responsibilities. Today, we'll be looking at understaffing in the hospital and how that affects communication as well as other improvements that can be made.
This is background information on understaffing. Understaffing is defined as when there's too few employees for a company to properly do its work and fulfill its responsibilities. A current statistic about understaffing in nursing is that there's just as many people retiring as there are quitting from burnout and understaffing. Currently, there's 40% retiring, 20% are quitting because they're understaffed, and 19% are quitting because they're burnt out, exhausted, and stressed. COVID-19 caused an increase in understaffing due to the mistreatment of healthcare workers, due to them having to work extended hours without overtime pay and having a heightened COVID-19 infection concern. This caused them to leave the workforce, which left the healthcare industry being understaffed. At Genesis Hospital, my mom, she was she is a nurse in pre-admission testing, and she got asked to be a volunteer to work on the COVID floors because they were understaffed during that time. She had to work 3 months, and her whole schedule was messed up because of it.
Multiple factors such as those mentioned in the previous slide directly contributed to a spike in mental issues among hospital staff. A large percentage of staff expressed symptoms of depression, anxiety, insomnia, and PTSD, bringing up the question if it is safe for healthcare workers with mental health issues to treat those in medical need. Research suggests that there is a strong correlation between understaffed or mentally ill staff and a decrease in patient care and safety, possibly due to a decrease in effective provider communication. Additionally, with beds full of routine infected COVID-19 patients, hospitals were forced to put critically ill COVID-19 patients on planes, helicopters, and ambulances to send them to other hospitals that had available beds. Additionally, more often than not, hospitals had to refuse non-emergent patients and those who were requesting a transfer. Due to the sheer number of patients, frontline workers were given excessive workloads and work hours with reduced paid, inadequate personal protective equipment, and the feeling of being unsupported, which led to a physical and mental burnout. Eastern Michigan University says when a healthcare facility is understaffed, the same amount of work falls onto fewer nurses who typically end up working longer hours. Doing so with little to no relief can cause mental, emotional, and physical health breakdowns. In addition, nurses who face constant stress can develop several health issues, including anxiety, exhaustion, depression, heart disease, hypertension, and musculoskeletal disorders.
Now that we know a little bit more about the background of understaffing, next we'd like to talk about communication in nursing. So there are two main types of communication. The first type of communication that we see in our work setting as nurses is communication with patients. The purpose of communicating with patients is number one, to understand a patient's need. We communicate with a patient to understand what they need from us and what they need just to support them as a whole through their experience. Secondly is to humanize their experience. Nobody wants to stay in the hospital because nobody wants to be sick. So communicating with our patients can help make them feel more at home in a scary setting. Lastly, to increase patient satisfaction, we want to make sure that our patients are satisfied with the care that they're given, and that we can provide the best possible healthcare. Characteristics of communication with patients consist of being patient. Some patients, especially if they're having difficulty communicating or difficulty thinking, will need extra time. We need to give patients ample time to respond, whether that's to our questions or to other issues that they may have. We want to keep instructions clear and understandable. This makes it easy for our patients to know what we're talking about. So we don't want to use any extremely complicated jargon. Second is our communication with our team or our IPE. So the purpose is to discuss our patient needs, and we want to collaborate in healthcare decisions. There are some things that we as nurses know and we as nurses don't know. So communicating with other teammates and other professions will allow us to gain additional knowledge in unspecialized areas. Lastly, we're there to support one another. Sometimes working in healthcare settings, there can be issues that arise or certain things that you experience, and being able to talk this through with your coworkers really helps. Characteristics include written and verbal communication, whether that's through email or through charts. And lastly, they have to be detailed and descriptive in order to make sure that we are capturing everything that our patient is experiencing.
Okay, so just to reiterate, like this is what our group kind of wanted to highlight in terms of why communication is important. So just to start us off, we have that communication is important in a nursing career because it minimizes mistakes, especially when we may, like Cynthia mentioned, we may know something that other professionals may not. So we wrote here, it increases redundancy and leads to providing more reliable healthcare and better outcomes. And this is in the best interest of our patients and just the reputation of the hospital that we are representing. We also wanted to mention that communication is important in how it fosters an honest environment. So while working in healthcare, it's important that you establish good communication networks with the people you work with and your patients so that the patient feels comfortable sharing things that they like some of their disorders or like things that they may be going through that they may not be comfortable sharing if it isn't an honest environment. And it's just important to maintain that welcoming environment to make sure that this is happening. It's also like important to mention that communication makes the nurses better at providing counseling, especially because a large portion of a nurse's career is spent with the patient and developing those intimate relationships, which many people fail to acknowledge. So it allows the nurse to better acclimate to their patient's emotions and just understand their patient on a level that most people outside the healthcare profession don't really realize. It's also important that people communicate, especially as nurses, because it minimizes conflict. It conveys professionalism and makes sure that you are representing your license, and the hospital, and just the profession as a nurse in general, and try to minimize conflict between patients, other health professions, and etc. And finally, we wanted to talk about how communication is important because it dilutes burden, especially when in healthcare there are very impactful stories and negative emotions involved. And it's important that you don't shoulder that burden alone. So yeah. And I just wanted to highlight this quote that I found. So much of a nurse's time is spent counseling patients and families, providing a therapeutic presence, and sometimes even mediating conflict. And yeah.
Now that we've talked about what types of communication there are and why it's important, we'd like to discuss some potential barriers within good communication. So within the two types of communication, the barriers that we might face with patient communication is a possible language and cultural barrier. So if the patient is not fluent in the same language, a lot of things can be lost in translation. And with hospitals being so understaffed right now, it could take a very long time to get a translator in. And same thing with the education barrier. Someone with a low reading and comprehension level will find it very difficult to understand medical information and make informed decisions. The next potential barrier is patient pain or anxiety. If a patient is in too much pain or has a lot of anxiety, it will be hard for them to listen and communicate their needs. And again, with patient load, when a hospital is understaffed, a nurse is loaded with more patients than they can handle, and that will affect how much time they can spend with each patient. An implicit bias with patients is another big thing that also goes with education and language barriers, because if the nurse has a prejudice against certain patients, that will not be good, and that will prevent good communication. Moving on to communication with the team, a power dynamic between a nurse and their boss can make it very difficult to communicate if a nurse is overwhelmed with the workload because they do not want to upset their boss. And the same thing with competing obligations and conflict of interest. This will be very difficult with understaffing if a nurse wants to impress their boss, but they also need to take care of their own needs as well. Reacting to feedback can go very poorly between teams on nurses, which will affect good communication, and same thing with imposter syndrome. With nursing, we have a big thing called Eat Your Young, where older nurses tend to kind of throw younger nurses under the bus and really stress them out, which leads to very not good communication. And lastly, with communication, unclear information between switching shifts with the nurse is not good communication and will very much affect the patient.
So now we're going to combine everything we've talked about thus far and discuss the effects of understaffing on communication. Here's a general overview. Understaffing decreases job satisfaction and leads to higher levels of stress, burnout, and mental health concerns in providers, thus affecting their ability to communicate effectively. Extreme amounts of stress can have both cognitive and physiological effects on nurses. They may become more forgetful, fatigued, and overwhelmed, which can affect their reaction time, decision-making skills, and overall performance. And with these things being compromised, it can negatively affect the nurse's ability to communicate with their patients and their colleagues. Another impact is when units are understaffed, there are less nurses available to deliver messages and carry out orders on the floor, which can slow patient care. Additionally, a shortage of nurses increases the workload for the ones that are present, making it difficult for them to give adequate care and attention to each patient, and the patient's care will likely be compromised as a result.
Now applying the issue of understaffing with communication within interprofessional communications is that with understaffing, less professions and specialties are represented when they could be critically needed in a situation. For example, there could be a case where a cardiac surgeon is needed. However, we do not have access to that. So then as a nurse, you have to take over that and help in that role where you may not have the best education in that. And then a lack of collaboration between other professions can hinder the exchange of critical information and the development of comprehensive care plans within the patient and their time at the hospital. In addition, there are fewer viewpoints and opinions about a patient situation when there is a lack of specialties that are represented. For example, a nurse could need opinions on a surgery that is needed and essential for the patient. However, they cannot give an opinion because they do not truly have an education based on that aspect. So there are a lot of different viewpoints and opinions that cannot be heard or represented when looking to give the patient the best care as possible. Also, understaffing breaks down the communication between all the different interprofessional units, as there's lack of all different professions where people cannot communicate what's needed to be done or how to best help the patient. For example, if there's a shortage of nurses in a particular department, communication between that department and others may suffer, impacting the overall coordination of patient care and the overall care of the patient, as a lot of lack of communication and roles are represented.
So now we go on to talk about how does understaffing affect communication in the form of patient care. First off, there's going to be overwhelmed communication channels. These will lead to higher workloads for each nurse. And when healthcare professionals are overwhelmed with tasks, communication takes a backseat. Understaffed environments create a chaotic atmosphere, making it challenging for effective communication to occur. Impaired patient care. This goes hand in hand with how understaffing can negatively affect patient care, since nurses may struggle to meet the ends of their needs of all their patients. This can make nurses feel frustrated and guilty for not being able to deliver the level of care that they want. The fear of compromising patient safety and well-being can discourage nurses from taking on more responsibilities, such as communicating with peers and coworkers about certain situations. Nurses often rely on the notes from nurses who worked the previous shift regarding vital patient information. Understaffing can result in rushed or incomplete handover notes as nurses try to manage their high workload. This can lead to important details being missed, compromising patient care and safety.
Next, we will discuss the improvements we can make regarding understaffing. To combat the understaffing of hospitals in the past, there have been laws and legislation passed to encourage nursing growth, including the Nurse Reinvestment Act of 2002, the Registered Nurse Safe Staffing Act of 2007 and 2010, and mandated nurse ratios at the state level. The change needs to be made on a national level to increase both the number of nurses able to practice and the nurse-to-patient ratio. There are, however, ways to improve understaffing and prevent it right now and in the future. This would be made possible by the introduction of certain laws, whether they be on the national, state, or hospital-specific level. These laws would mandate specific provider-to-patient ratios, ultimately making hospitals and their staff safer. Overall, to be successful nationwide depends on the accountability provided by the state, federal government, or independent hospitals. New legislation may be passed, but without holding organizations responsible for their actions, it is only a piece of paper. Addressing the impact of understaffing on communication requires a comprehensive approach that involves not only increasing staffing levels, but also fostering a culture that values effective communication, encourages teamwork, and prioritizes the well-being of healthcare professionals. This can contribute to a more supportive and communicative healthcare environment. Here's a list of our sources. And I would like to conclude by saying thank you all for listening.